Hello everyone, welcome back to our channel. Today we're diving into the recent changes affecting the UK Health and Care Worker Visa, and what these changes mean if you're planning to work in the UK healthcare sector. The UK government has recently announced significant updates to the Health and Care Worker Visa system. These changes are designed to address the ongoing healthcare staffing challenges while also ensuring sustainable recruitment practices. Before we dive into the details, make sure to subscribe to our channel and hit the bell icon for upcoming updates. First, let's talk about the biggest change: the new minimum salary requirements. The government has increased the minimum salary threshold for skilled workers, but healthcare workers still benefit from special considerations. Healthcare positions remain on the shortage occupation list, which means they still qualify for the lower salary threshold. This is particularly important for nurses, care workers, and other healthcare professionals who might be concerned about meeting financial requirements. For nurses specifically, the current requirements focus more on qualifications and language skills than salary thresholds. You'll need to meet the NMC Nursing and Midwifery Council requirements and pass your objective structured clinical examination within your first few months in the UK. The good news is that many employers are now offering objective structured clinical examination support and training as part of their recruitment package. Care workers are seeing some significant changes too. While the sector remains open for international recruitment, there's increased scrutiny on employers. Care homes and healthcare facilities must now demonstrate they're following proper recruitment practices and providing adequate support for international staff. This actually benefits you as an applicant, because it ensures better working conditions and support systems. One positive change is the processing time for these visas. The UK government has prioritised health and care worker visas, meaning they're typically processed faster than other work visas. Many applicants are receiving decisions within 3 weeks, though this can vary depending on individual circumstances. Another important update affects family members. Your dependents can still join you in the UK under this visa category, and they maintain the right to work in most sectors. This makes the UK an attractive option for healthcare professionals with families. The visa duration remains generous. You can stay in the UK for up to 5 years with this visa, and it can be extended. After 5 years of continuous residence, you may be eligible to apply for permanent residence, which is a significant benefit for those planning long-term careers in the UK. For those worried about costs, many UK healthcare employers are now offering visa sponsorship packages that cover visa application fees, immigration health surcharge, and even relocation expenses. This is worth investigating when you're looking at potential employers. Language requirements remain crucial. You'll need to demonstrate your English language proficiency through approved tests like IELTS or OET. The required scores haven't changed, but some employers are offering language support and preparation courses. One notable change is the increased focus on professional development. Many NHS trusts and private healthcare providers are now required to show clear career progression paths for international staff. This means better opportunities for advancing your career once you're working in the UK. If you're currently in the application process, don't worry too much about these changes. Most of them are aimed at employers rather than individual applicants, and they're generally making the system more supportive for healthcare workers. The key takeaway here is that despite these changes, the UK remains very much open to international healthcare workers. The system is becoming more structured and supportive, which ultimately benefits you as an applicant. For those thinking about applying, now is still a good time to start the process. The demand for healthcare workers remains high, and employers are well versed in supporting international recruitment. Remember, these changes are part of the UK's ongoing commitment to strengthening its healthcare workforce while ensuring proper support for international staff. While some aspects of the process have become more regulated, the overall opportunity for healthcare professionals to work in the UK remains strong and viable. Stay tuned for more updates, and feel free to drop your questions in the comments below. Thanks for watching, and don't forget to subscribe for more UK immigration and healthcare career updates.